Hi, my name is Dr. Serena Chen at IRMS at St. Barnabas in New Jersey, and I wanted to talk with you about COVID-19. We're all on a big learning curve right now. It's been like drinking from the fire hose. I'm not a virologist, I'm not an infectious disease specialist, but um, we all have to deal with COVID-19 vaccine, and I'm getting a ton of questions. I can't answer all the questions now, but I thought I would share with you this cool resource from the University of Massachusetts. So this is a handout. It's a PDF, and we're going to show you how to link to it. This is distributed by the University of Massachusetts Medical Center Bay State Health. um, you can direct your questions to Dr. Elizabeth Schoenfeld about the utility of this tool. Um, this is a link right here for you to give feedback about the tool, and we'll put a link on the website. But let's go through the tool, because I did want to show you. This is really nice because it's a handout, but this is exactly what kind of conversations we are having with our patients about COVID-19. Should I take the vaccine? Should I get pregnant? Should I not get pregnant? Should I use IVF? Should I not use IVF? This is true of all medical decision making. We are always looking at the literature, the science, what is known, what are the guidelines, what are the recommendations. Ultimately, though, you have to decide as the patient in your individual situation. You want to understand the pros and the cons for you individually. What are the pros and the cons? What are the risks and the benefits? And usually what you're trying to do is maximize the benefits and minimize the risk. So that's the same thing with the COVID-19 vaccine. So let's go through. I'm pregnant. Should I get the COVID-19 vaccine? And for most people, getting the COVID-19 vaccine as soon as possible is the safest thing, because we're in a pandemic and people are dying and getting really sick from COVID-19, and there are long-term sequelae from this disease. So the COVID-19 vaccine represents protection. So, but you're pregnant, there's not much data, and we've all seen the guidance. They didn't really test this vaccine in pregnant women. And so ACIP, the CDC, the FDA, the Society for Maternal Fetal Medicine, the American College of OBGYN, and ASRM have all said we can consider the COVID-19 vaccine for people who are pregnant. People who are pregnant should not be forced to get the vaccine, but they should not be prevented from getting the vaccine. And people must weigh the risks and the benefits. And for some pregnant patients, the benefits of the vaccine will outweigh the risks. For other pregnant patients, they may want to wait until we have more safety data, especially if they can take precautions to reduce their risks of getting exposed to COVID while they're pregnant. So your choices goes through. Get the COVID vaccine as soon as it's available, or wait for more information about the vaccine in pregnancy. So what are the benefits? COVID is dangerous. It's more dangerous for pregnant women than it is for non-pregnant women. So you're more likely to end up in the hospital if you're pregnant than if you were not pregnant with COVID. You are more likely to end up on a ventilator if you're pregnant with COVID than not pregnant with COVID. It may impact your pregnancy negatively. The COVID vaccine is 95% effective. The vaccine cannot give you COVID. There's no live virus. It does not contain any ingredients that are known to be harmful to women, pregnant women, or to the fetus. And we have a lot of experience with multiple different vaccines in pregnancy, and we know that those are safe. So what are the risks of getting the COVID vaccine? The COVID vaccine has not been tested in pregnant women. So we're talking about the mRNA vaccines, Pfizer and Moderna. They have not been tested in pregnant women. So we don't have data on whether the COVID vaccine works in pregnancy, or whether it's safe in pregnancy, or how does it affect, the fetus. People who are getting the vaccine will probably have some side effects. And there's some side effects listed here, like soreness, fatigue, headache, muscle pain, chills, joint pain, and fever. The most dangerous one is fever. Anything over 100 can possibly increase the risk for pregnancy loss or birth defects. So we definitely want to prevent fever. And you could get fever from the COVID vaccine, but if you get the vaccine, you get a fever, you can take Tylenol. And Tylenol for fever in pregnancy is usually safe and effective at preventing the consequences of fever in pregnancy. So, what are the recommendations? Since there's no studies for pregnant women, the Society for Maternal Fetal Medicine strongly recommends that pregnant women have access to the vaccine, and that they be able to discuss it with their personal healthcare provider so that they can make their own personal choices. And the ACOG recommends the same thing. ASRM just came out with a statement as well. So what else should I think about to help me decide? Make sure you understand as much as you can about the vaccine. Ask a trusted source like your midwife or your doctor. There are multiple sources, reliable sources for information. And I just mentioned some of them: the CDC, the FDA, your state Department of Health, your doctor, your midwife, American College of OBGYN, ACOG.org, the Society of Maternal Fetal Medicine, SMFM.org. They all put out lots of materials so you can learn more about the vaccine and the use in pregnancy. Think about your own personal risk. It might be safer and easier for you to just stay home, shelter in place, wear a mask all the time, wash your hands. But, if you work in the emergency room, you're going to be exposed to COVID every day, and you are going to be at risk for getting COVID if you don't get the vaccine. So maybe if you're pregnant and you work in the intensive care unit, maybe you should get the vaccine. But maybe if you work at a bank and are now sheltering in place at home and just on Zoom all day long, and the people in your immediate household are also very safe from COVID, maybe you can wait until there's more data. So here's a list of risks. Like, what if you have contact with people outside your household who do not wear masks? What if you're 35 years or older? What if you're overweight? What if you have diabetes, high blood pressure, heart disease, or other severe medical diseases? What if you're a smoker? What if you're an racial or ethnic minority that has a high rate of COVID vaccines? What if you're a healthcare worker? On the other hand, what if you're low risk? You always wear a mask, everybody around you shelters in place, you're never exposed to people who are out and about, everybody that's in your tiny little circle is also sheltering in place. You are really worried and really nervous about the vaccine. You really don't want to take it. You really feel just uncomfortable. What if you've had a severe allergic reaction to an injectable medication or a vaccine before? Might make sense not to get the vaccine right now and to wait until we have more data, more reassuring data that will make you more comfortable. What about breastfeeding? The Society for Maternal Fetal Medicine says there's no reason to believe, based on what we know about the ingredients in the vaccine, that it will affect the safety of breast milk. But again, this is something that you should talk about with the baby's doctor, the pediatrician. So in summary, COVID seems to cause more harm in pregnant women than in women of the same age who are not pregnant. The risks of getting COVID vaccine during pregnancy are thought to be small based upon what we know about the physiology of pregnant women and the physiology of the COVID vaccine, but are not totally known. you need to consider your own personal risk when you are making this decision. If your personal risk is high, or there are a lot of cases of COVID-19 in your community, it may make sense for you to get the vaccine even though you're pregnant. On the other hand, if your risks are very low, it may be reasonable to wait. And whether or not you get the COVID vaccine ultimately is your choice. This is your body, your pregnancy. It is your choice. But we want you to be informed. That's the most important thing. And then they have some quotes from some doctors who are high risk and pregnant and thought about this question and ultimately decided to get the vaccine. This is like a QR code and a link, so you can let them know about the survey and then a little bit more information like, mRNA doesn't get into the cytoplasm and does not impact your own DNA. It is degraded very, very quickly. So, and then there's some references here. So there's a lot of great information out there. I really liked this tool because I feel like it kind of goes through exactly the same conversation I've been having multiple times every single day with lots and lots of people who are trying to get pregnant or thinking about pregnant or already pregnant, people who are high risk and low risk, who are, trying to make this decision. So I hope this is helpful to you. And let us know what you think. I'm gonna try to continue to give you more information as we learn more. And obviously, there's a lot that we don't know right now, but we're learning more every single day. So we'll talk more soon. Thanks. Have a great day.